everybody. So most of you know me. So I'm Arun. So today we'll be having our session regarding the private health insurance, like how it will be beneficial and what kind of services, and also it will be at the end a Q&A session. So I have prepared a couple of questions which will be like very generic. So some of you who have attended previously, it might be a repetition for you to understand how this all works once more. And Andy here will explain us a bit deeper when he's the professional. So that would be the right thing. So a short intro on Andy. Andy's from a company called ARAG, and he's been in this field almost now 30 years in the health insurance sector. So I think he's the right guy to do that. And I don't want to tell everything. So I'll give something to Andy. Please tell about yourself and we'll start the session, Andy. So once again, thanks everybody for spending your evening, and thank you, Andy, once again for coming by.
Yeah, thank you, Arun. Not much to tell. You said everything. I'm already very old because I'm for 30 years in the business, but I started with 19, so I'm still young. I'm not even 50. Yeah. No, I'm having 2 kids. I'm having a Filipina wife, so I'm also in an international family. I know how it feels for you guys to come to a foreign country. Not only because of my wife, but also of myself. I studied for 1 year in the United States. When I was 17, 18 in high school, I graduated from high school there. And yeah, when I was 17, I went there all by myself in the foreign country. So I know how it is in the foreign language. I know how it is with papers and stuff. So I also know it in Germany from the point of view with my wife, with all the Ausländeramt and everything. So I guess I can feel you, and I have lots of international customers already for the last 20, 30 years. Yeah, and I'm happy to be here and would be glad to consult somebody of you following this session also, yeah, just in private call if you're really interested.
Great, I think that's a great introduction. Thanks, Andy. And we have with us Leventon also. I think most of you have also seen him on our interviews. So hi, Levi, welcome to our session. Once again for spending time. Thank you. Yeah, I'll go directly into the frequently asked questions which I prepared. So it will be like a recap. So could you tell a short intro about like the private health insurance, Andy, like for whom, and also like what it is basically?
Okay, you have in Germany, you have the 2 systems. You have the private and the public one. And the private health insurance is actually not like in India. In India, I've had to learn that then some private insurances, not everything is covered and some things are left out. So the private health insurance in Germany really is the better solution, yeah, from the coverage point of view, and also for a lot of people from the financial point of view, from the premium. Because in general, the public is mandatory up to a certain income. And above a certain income, if you are employed, yeah, I think most of you guys are employed. And if you are above 65K, that one is not stiff. It's rising every year. Yeah, but it's rising every year like 1,800 euro the last couple of years. So it's adapting. But if you are like above 65 or 70K, including bonus, then you are eligible for the private one. And then it makes actually more sense if you don't have, let's say, 3 or 4 or 5 kids, or plan on having 3 or 4 or 5 kids. I myself have 2 kids, as I mentioned. I'm privately insured for 23 years now, and I pay together with my children less than 900 euro. And everybody who is eligible is paying the maximum in the public one of 923 euro right now in TK. I guess most of you guys are in TK. And if you look at your salary slip, it will be something like 764 something for the KV, for the Krankenversicherung, and then plus the PV, the Pflegeversicherung, is like 150 something. So it adds all up to, I think, 159. So it should add up to 923. And that's a whole lot of money, of course. And in the private one, we are not calculating the premium from the income, but from each person, from the age, from the precondition, health condition, and let's say most people are between, let's say, 400, 500, 600 euro adults, and kids between 100 and 200 euro. So yeah, that's why it definitely makes sense for people who are single. It also makes sense for people who are married if you are both working, or if one of you is working and you don't have a kid, or you only have one kid. Yeah, it's doesn't really, well, you have to think if it makes sense from the financial point of view. If you have 2 or 3 children and one is only working, then we of course have to check the situation if it makes sense or not. From the coverage point of view, it makes always sense.
Okay.
Because there's a lot of things what you probably don't know in TK, what is also in public in general, what is not covered. Yeah.
Okay. Yeah. Okay. That, I think that was a very brief and good introduction, I would say. I just have a question following that, since you mentioned like the coverage in Germany in private is better. So is there anything like like a guideline that is protecting, saying whatever offered in a public insurance is always covered in the private, say for example?
In general, you can say that, yeah. That is the coverage, as I said, in the private sector is much higher.
Yep.
Let me make one example, maybe for the most important thing. In my point of view, the most important thing is where can it get really expensive? It can get really expensive most of the times in the hospital. Yeah.
True.
Because if you have surgery or you have a complicated disease, need a surgery, need a specialist, then it is the case in the public one that you have the right for the next possible, for the next available hospital near to you, near to your place. So, for example, you live in Munich, then for the next possible hospital in Munich, and you cannot choose from every hospital in Munich, because you have only the right for the next one, basically, and for the doctor who is on duty. That is actually your right. Okay. Of course, it's also possible to go to another hospital if that hospital is cheaper or if that hospital has the same price. Not all hospitals have the same prices. You don't know that. You also won't see it somewhere. But there is big differences. And of course, there's also differences in specializations or qualities of doctors. And in the private one, you have the free choice of the hospital and the free choice of the doctor, not only within Germany, but also within Europe and worldwide. Okay. Even if you would have a planned surgery, which is not life-threatening, which needs to be done, and you could plan it, you could even do it in India if you feel better there because of the language. Okay.
I think I'll come back again to that point because we have another question related to that, which is also a very common question for Indian people to know. So I just want to go back to one point regarding the calculation of premiums to make a clear statement. So as per your statement, the private health insurance is estimated based on the health as well as the age of the people. And definitely who are eligible can only take it. And the public system is moreover based on the income of the people, right? Is it like that's the major difference? Okay. And why is that? I mean, I know that the private health insurance has many benefits, but why is it normally cheaper than the public in most cases? Like, is it because of healthy people, or please?
No, it's because actually, if you look at the public one, it's a social security. It's a social insurance. Social means the people who earn well, which most of you are, I guess. The people who earn well pay the most. They pay 900 plus or up to 900. Yeah, and there's in the whole public system, everybody is there because the health insurance in general is mandatory. So all the people who are jobless, all the immigrants who don't have a job, all the people who have a part-time job, maybe only earning 1,000 euro or 2,000 euro, they are all, of course, insured in the public one, and sometimes even with 2, 3, 4, 5 kids. Yeah, and in the public system, as I said, it doesn't cost for each person. So of course, if you have a part-time job, you earn 1,000 euro, or you are even unemployed and you have 4 children, then it's very good to have the public one for you. But who is paying for it? In general, the people who are earning more. Okay. Yeah? Because also the public one doesn't need 900 euro for a 30 or 40-year-old person. True. But it's supporting basically the ones who pay less. And so we have a calculation because we only have, I mean, the most people who come to us are healthy. Of course, we have a health check. Also, if you had some preconditions which are not too serious, I mean, what is serious? Serious is if you had cancer. Serious if you have diabetes or something like that. That is a problem. Then you won't be eligible. Yeah, but we can talk about any disease, of course, privately. But if you had a surgery 2 years ago at your knee or ankle, and it was only one time, it's all possible. Yeah.
Okay.
Or so you don't have to worry really. So we are checking also on the people's health, of course, but of course also people who are privately insured get sick if they are getting older, and then of course it's also paid. But the main reason is, as I said, we don't have people in there who are not paying.
Okay. That thanks for the answer. I just want to answer something on the chat. Guys, Andy will show us a small calculation in the middle or at the end regarding how this works based on maybe my profile. And of course, we'll cover the kids also, Sneha. So I think it should be okay. So don't worry. So the next question which I wanted to ask is, from what age it is bad to actually change to a private system? Like till what age it is best, like financially also, because that also matters, right?
Well, if most people enter it between, let's say, 25 and 45. Yeah.
Okay.
You can narrow it down to 30 to 40, but most people are like from 25 to 45. You can also, of course, enter it with 49 or 50, but then it doesn't make, I mean, it gets more expensive, of course. But it doesn't get more expensive automatically than 900 euro. If you are single and you don't have a family and you don't have a child, still, if you enter with 50 or 51 or 52, it can be cheaper than the 900 euro and still better quality. Yeah, but as I said, mostly between 30 and 40. Yeah.
Okay.
And I see also the question in the chat here: how much does the premium increase as you grow old?
Yeah.
If you start with 35, you always have the price of 35. It doesn't automatically get more expensive every year. That is very important. If you start with 30, you get the price of 30. If you start with 40, you get the price of 40, even if you are 50. Yeah, so that is in general better to enter early if it's possible for you.
Okay, that means earlier the cheaper it is, basically.
Yes, you can say depending on the product and on the product line and on the deductible, there's different possibilities. It's a difference of, like, let's say 10 to 20 euro for each year you grow older.
Okay.
So if you enter 10 years later and you have the best product, it will be already like 150 to 200 euro more expensive. And if you have the lowest product, which is still better coverage than the public one, maybe it will be a difference of 100.
Okay. I think that
after 10 years.
All good, yeah. So I want to break one myth or some. I mean, this is something that is commonly spread among all expats. Like even when I started to look into this topic, especially. So if a huge operation or something happens, do I have to pay everything upfront from my hand just because I am in a private health insurance? Is something that always spreads on Facebook groups mostly, that privates won't pay or private doesn't cover. So could you tell us more on this?
So first of all, as I said before already, everything is covered. Nothing is left out. If we do the health check with you, we don't send you to a doctor. It's answering questions together with me. We can do it online. It's very convenient, very easy. Yeah, doing it online via Teams or Zoom, and then you just sign on an application. But to come back to the question itself, what was it again? I lost it now.
No, I just said, like, in private, people assume that you always have to pay.
Prepayment.
Yes.
Right. Yeah. In general, it is for small bills. You pay them first, and you get it reimbursed. But you can choose if a bill is too big for you. And in hospital, in general, I would say if it's a surgery or if it's even more, you stay for 2 weeks or whatever, the bills will be probably 4 digits, 5 digits, yeah. And not everybody is having 4 or 5 digits on the bank account just waiting to be paid. I mean, most people who have money invest the money, yeah.
Yeah.
And so you don't have to pay it to prepay it if it's bigger ones. you can hand it over to us, and we are paying it directly. And the hospital itself, I mean, the hotel costs for the hospital, like the room, the nurse, the food, the electricity, the telephone, that is all paid directly anyways. You also get an insurance card like in TK. And if you would go into the hospital, if you check in, you give them the card, and then these hotel costs are paid directly by us. Okay. And what you get after your stay, you get bills from the doctors who treated you, who did the surgery. And as I said, if bill is too big for you, you can hand that bill to us. It's better anyways to hand it to us right away, because sometimes they charge you too much. And we are also checking if they are really charging you the right thing. Yeah, so I would never suggest to pay a big bill right away. Yeah, I would always suggest, even if you have the money on the account, I would not advise to pay 2 or 3 or 5 or 4,000 euro. Hand it over to us, because maybe the doctor tries to cheat on you and takes 1,000 euro too much. And once you paid, it's very difficult to get it back. Yeah, we would try to help you, of course, but pass it over and we can pay it.
Okay, so in short, can I assume like if it is like something very small, say 100, 200 euros, you pay and then you can claim? Or possibly if it's going to be big, then you don't have to do it, but rather you can just transfer the bill to the company, or that is what is advised. And just one question which I have, like there is an option like people can choose like no self-deductible. In that case also, can they just pass on all the bills directly if they want to? I know what's the disadvantage, I'll come to that later, but can they just give the bills directly, or like give the card and get paid?
You can. It's your decision when you pass the bill. Yeah, and then you say, please pay directly. It's possible.
Okay. I know like it affects the payback, so we'll come to that at the end of the session. So this is why, guys, I want to ask this question. So there is an option for you to use the private, same like the public, just give the card, but you will lose a advantage of payback option, and we'll come back to that at late. How much is that and how it's calculated and so on. I think Andy can give us an example.
The payback will come to it at the end.
Yeah.
But if you are in hospital, generally, of course, if you're hospitalized for a couple of days or you have a surgery, the bills will be a couple of €1,000. In that year, probably the payback won't make sense. But if it's not the hospital, but the normal doctor, the normal bad cold, or the normal upset stomach, that is like 100, 200, 300 euro. It always makes sense to pay it yourself. Why, we will tell you later.
Yeah. So there is one question on the chat which could be also similar to what we are speaking right now. So what if anyone wants to switch from one private insurance to another insurance company? For example, someone from Allianz wants to move to ARAG now, like after seeing this, can the entry premium be considered of the first company?
Yes.
Yes.
What he means here also, I'm reading it, entry premium age. Yes. You are actually, if you're paying, let me make an example. You come to us and you have the premium product and you pay 600 euro. And let's say you are 35. Okay. And we don't actually need 600 euro to cover up all the expenses of a 35-year-old. We only need, let's say, 400 euro. So we are saving 200 euro for your age. Yeah. And these 200 euro, you will be able, if you change from private to private, you will be able to transfer it to the next company, not 100%, but something like 80 to 90% you are able to transfer. And so let's say you want to change 5 years after that with age 40, then you won't be age 40, but this amount of money what you transfer will be credited. So you are something like not 35, but 36, let's say, because you can transfer like 80%.
Okay.
But there's still the possibility to change the companies. Yeah.
All right. Okay. I think that clarifies his question.
If somebody is reading something else, if they research on the internet, it has been differently until 2009. So it's already 12 years like this.
All right.
What I just said. Before 2009, you could not transfer it. Yeah.
Okay.
And that's why it's still somewhere on the internet. You cannot change it. Once you are in one company, you cannot change to another one. That is only for the old guys like me who are insured for 23 years.
Okay.
And I started in 1998, and I cannot transfer it. So of course that's a disadvantage, but the government changed that in 2009, and now it's possible.
Okay. I think that's a straightforward answer. Another question is, I think this will also be running in the minds of people who are watching this. So I have moved into a private insurance, and for some reason, like this Corona pandemic, something else comes, and I have to, I become unemployed, for example. In this case, how will my coverage, like, will I be automatically put into a public, and will public say at that time you will not be covered or you will not be taken inside? So what is the option?
No, the option is if you're unemployed, in general, you automatically go to the public one. Yeah. But if you don't want that, for example, let me make an example. I have to switch on the light. It's getting dark here.
All good. Yeah.
It's like the dark ages here. So if you would want to stay in private, because let's say you lose your job in end of May now, and you know already you have a new job in August. Yeah. Okay. So you're unemployed for, let's say, 2 months. Yeah. And you say the new job is I earn 70K, and the new job I earn 90K. So then you can also tell the Arbeitsamt, please let me stay there. They're also supporting that as what they would support the public one, and you can stay in the private one to save your saving funds for the old age. What I just said. And the example with the 600 euro and the 200 euro, what we are saving for you, because once you are out, yeah, you that money would be gone. It's lost. But if you are unemployed, or if you earn constantly less than 65K, you have to go back to the public one. All right. It's mandatory. Okay. So you don't have to worry that you don't come back. Yeah. If you are keeping your job, if you are still above 65K, then you cannot go back. That is right. But tell me one reason why do you want to go back? Yeah, you pay less and you have the better coverage. So I can tell you after 23 years, you don't want to come back. And there's also other privileges. You get faster appointments at doctors. You have the 1 bedroom, the hospital. So why do you want to go back? No, yeah, I think that's a very good point. I mean, the question was if there is a lot of fluctuation going on right now in the job market, and also your classic example which you gave, if people want to move to a better paying job and they just want to take a pause for 2 months, like a pause, and still they can hold on to a private, is something very, very useful tip, I would say. Yeah. That my personal. I see this question here with the medicine. Can I answer that? The last one? Please. Yep. Yeah, I don't know if everybody's seeing the chat. I'm going to read the question. Are all medicines reimbursable, or is there any restrictions like in public? It depends on the product. We have 3 product lines, but in the 2 top lines, which are mostly suitable for you because you are being employed, every medicine is paid. You don't have to contribute. You don't have to contribute 5 euro or anything. All the medicine is paid 100%. All good, yeah. I think there's another question coming immediately. I am in TK for 1.5 years. Am I allowed to change to private? I heard that private look for at least 2 years minimum. I think 2 years minimum in public. Is it true? It's both true. Yeah, I mean, if you are freiwillig versichert, freiwillig means you are above the 65K already for the whole time of the 1.5 years, then you can change. Yeah, you could also change less than 1.5 years if you are above that 65K. If you changed from one public to another one, let's say you started in AOK and you changed to TK, there was always a limit of 1.5 years that you had to stay a minimum of 18 months. Okay. But that was also changed to 12 months at the beginning of this year. Yeah. So you mostly will get out of TK or the public one, and with us, with the private one, it's a minimum of 2 years. That's true. Yeah, that's true. But the 2 year is always, our years is always from January to December. So it means if you start, for example, this year in August or in September, because you have a cancellation period of 2 months, the public one. Yeah, so it means it has to be 2 months in between, 2 full months. So if you would decide in May, which is already very narrow, yeah, because it's already only 1 week. It would be June and July in between. You could start 1st of August. If you decide in June, which is for all of you guys probably the better idea, because we only have 1 week to decide, yeah. But so then you would start in 1st of September. And if you start 1st of September, the first year of the 2 years is done already 31st of December. So the first year is actually only 4 months: September, October, November, December. So you have even less than 1.5 years.
All good. Yeah. So that means someone who has been in public has to be in 2 years in public, I mean, with this explanation, in order to move to the private, basically.
No. They can actually, as I said, even if you just signed up for the public one.
All good.
And you are above 65K, you don't have to stay for 12 months or 18 months. You have the cancellation period of 2 months.
Okay.
But with us, to go to another private one, you have this cancellation period of 2 years. That's true. Yeah.
Okay.
But once you enter ARAG, you never want to leave us again, of course. Why?
Okay. No, I think her question was to public to private, if I understood it right. That's why I asked. I asked the question basically, but I got more information from you right now, which I also will be adding into our meeting minutes later. So thank you for that.
Thanks for that question. Yeah, even we've been doing this for several times.
Yeah,
there's always coming new questions, right?
That's true. Because this is something I have not noted down previously. So I think this is something very informative for others also who will be receiving this. Thanks for that. So I'll go to next question. So I think we have answered it. Maybe it was not so clear. So if somebody is earning, for example, 60K, but along with their bonus, say Winax bonus or profit bonus, they're getting 65 or above, are they eligible to take the private health insurance?
The bonus is counting, but if you start a new job and it hasn't been proved that you always get the bonus, yeah, there has to be like a certain regularity. Yeah, like let me make an example. There's jobs where you get a bonus and it never really happened that nobody got a bonus. Yeah, then it will be credited right away. But if there is also like colleagues where the bonus is 0, yeah, then it doesn't count. It's a little bit complicated. Okay. But if you have these cases, just send your papers to Arun. He will forward it to me. Yeah. I will come back to you. We will check it. We have to check the working contract, and then we have to see if it makes sense. In general, you can say that your employer should know. Yeah, the HR system should know. Some also don't know. I know that. Yeah, or some are saying it wrong. You always can ask us. I can always double check for you. But usually, once you get over that 65K, your employer even has to tell you that you have that you're eligible now and that you have the right. And if you start with a new employer, you have the right away. Yeah, and we, as I said, with a bonus, sometimes it's a little tricky. Okay. But let's say, for example, my system, I also have a bonus. Yeah, and if I'm below 80%. Yeah, or I won't get the bonus if I'm below 50% of my goals. Okay. Yeah. So if I'm below 50% of my goals, I will not reach the end of the year. Let me make it clear. Okay. Yeah. So there has never been in the history of my company anybody of my colleagues has not gotten a bonus. Yeah. So, and in that case, the bonus counts. All good. Yeah. I think this is. I don't think even my company, nobody had the problem. It was performance related bonus, for example. I think some companies also offer fixed bonus, like a company bonus, like the whole company's performance determines the bonus percentage. I think in this cases, the chance of someone not getting bonus is very, very less, even during Corona times. Yeah, of course. So thanks for the question and the answer. So I see a lot of questions here, guys. So I will try to move on to the topic of, say, for example, the maternity and kid, because it was asked first. So, and then we will come to the example, and I'll cover Prashant's question, I think also Rajesh. I hope it's fine. So next is regarding the pregnancy, Andy. So what is all covered during pregnancy? And I think the other question is also, if somebody is planning to have a child, can they also plan it
to have their, the delivery in India because they have the family and the family doesn't have to travel all the way here. So could you
Yeah.
tell us, please, little bit deep in this aspect? Yeah.
So of course, if you are not pregnant yet, yeah, even if you're pregnant already, then it's covered, of course, because pregnancy is not a disease. Yeah, pregnancy is something positive. Yeah, of course, we ask health questions. If there is already an existing pregnancy which is complicated, yeah, then we might say we want to wait for you. But you sign the contract now, you get pregnant next year, then it's, of course, everything is full covered, and it's even much more coverage than in TK. For example, the public one, yeah, not only TK, all the public ones, they are paying for the 9 months, they are paying 3 checkups. One checkup in each trimester. Yeah. You have in the pregnancy, the trimesters. And with us, you can do it every month. Yeah. So when my wife was pregnant with my daughter, we were there every 4 weeks. With my son too, but the daughter was the first one. And we did the checkups every 4 weeks. Yeah. It makes you kind of feel more comfortable, of course, than what if you have only to wait for every 3 or 4 months. Yeah. And planning the delivery in India, as I said, you can plan things abroad. You are having a coverage of 12 months in Europe and 3 months in the whole year outside of Europe. So that if you really consider that, then you really have to plan it well, because the airlines only transport you if you are pregnant until the 7th month. Yeah. So then you will have to go really 6 months, 6.5 months. Yeah. Let's say last minute before this airline don't transport you anymore, plus 3 months you would be covered. So it's possible. Yeah. And if it's an emergency, of course, you have to stay longer there. It also will be covered, of course. Yeah. And you also can prolong that 3 months by paying an extra premium. So if somebody is really planning that, yeah, it's possible.
Perfect. I think this question will be informative for a lot of people, because I see quite a few people are planning to get married and so on chat. It's a good thing for this topic. I'll go back to the second or third question which was asked in the chat. I think it's also a very important one. What about kids? Yeah. So we know, like for adults, we are getting calculated based on a few things. How much will a kid cost on an average? And what about the newborn baby we just spoke right now?
Kids are from age 0 to 15. It's the same price. Yeah. And of course, with the kids, you don't have, you will never suggest to have any deductible. Deductible means the share that you have to pay yourself. Yeah, you maybe know that from your car insurance or from your legal insurance. Yeah, but that's also possible in the health insurance. With a kid, I would never suggest to have a deductible, because if the kid is sick, you go to the hospital and the baby cannot talk and say it hurts really bad, let's go to the hospital. Yeah, so you always go. But a child is until age 15 is between 150 euro and 200 euro, depending on the product line. And from age 16 to age 20, it gets like 20 or 30 euro more expensive. Yeah.
Okay.
So it's still affordable. It starts getting more expensive age 21. But the kids at that time either will study or they will do Ausbildung in Germany. And in either cases, they are in the public system themselves again. And you don't have to pay for them anymore. Yeah, usually Abitur is with 18 or 19. Yeah, if they do Ausbildung, sometimes even with 16, then they will be having their own insurances. So you don't have to worry about that.
I think they will be put into the public automatically when kids start to
once they start Ausbildung, once they start to sign up for university, they're automatically insured in public. Yeah, they can opt out. They can choose to not go into the public one if the father or the mother wants the private one to be continued, but then they have to pay for it.
Okay. I think then it's not an easy affair for paying adults when they're out of the house. Thanks, Andy. So next question I have for you is something also on the chat. It's also an FAQ. So there are people, for example, where one of the spouses is earning more than 65K or even both, or doesn't matter. So other one is earning lesser than that for some reason. And in that case, can one stay in private, one stay in public, and will this be beneficial? And also, like, how the kids will be handled in this case?
Okay, if yes, it will be possible. Yeah, it doesn't have to be the family affair thing.
Mm-hmm.
If both are working, that's actually my case. My wife is working part-time. Yeah,
Mm-hmm.
so she's in the public one, but she's having additional insurances, Zusatzversicherung.
Mm-hmm.
Yeah, in the first 9 years of our marriage, she was privately insured.
Mm-hmm.
Then when the kids came, she took a break, and then of course to take care of the kids.
Mm-hmm.
And then she is working part-time now again. So she's in the public one and I'm in the private one. But if one is in the public and the other one is in the private one, then the kids have to be insured privately. Yeah, because the government has said you cannot just pick the advantage.
Mm-hmm.
Yeah, and the kids are still for free in the public system. So in my case and in the case of the question,
Mm-hmm.
the kids have to be insured privately. Have to be means financially. I want my kids to be privately insured because I want the best possible care for my children, of course.
Okay. That's a very valid point. I think there is one question also which came regarding the general topic of what is the advantage of buying something from ARAG compared to another company. So this could be something you could explain.
Well, we are in the if you go to, for example, Check 24 right now. Yeah, that's the explanation. We are top one, top one right now with the product made best. If you compare the price and coverage, we have the best product right now in the market since end of 2019 already, for almost 2.5 years now, and having lots to do, having lots of inquiries. Yeah, there's nothing left out. Our prices are very, very on the same level. No, we didn't have big rises the last couple of years, and it's also probably that it will stay. The prices will stay. The coverage is very good. Yeah. If somebody has an offer of any other insurance company already, private one, then just give it to Arun, give it to me. I will compare it for you. I have a program, IT program, not from ARAG, but really independently, and it will do the pro and con. Yeah. And also contra ARAG. No, not only pro ARAG, of course. It will be really fair. But I'm offering it to you because I know about our market position.
That's nice. That's great. I think this is a very good info that for the last question.
It's an independent program. What you also can Google, yeah, that it really exists. It's not faking it into our direction. It's really true that the market position is #1 right now.
Yeah. I think Leventon also shared me a picture of the previous year's award, and I also put on a video. But I think your points are valid enough for the augmentation. Yeah, that's very nice. So I have a next question. I think we have covered regarding maternity and regarding kids. So next question will be, for whom it is like freelancers and also employees. For whom you don't recommend is like basically like. Could you tell more about it?
What was that again? I didn't get it.
For whom you do not recommend it, basically, like private health insurance, for example.
For whom I would not recommend it.
Yes.
If you are too old, if you are too sick, or if you have too many kids.
All good. Because this question came to direct message to me, I want to ensure answered. So
if we would have if you are seriously interested and we have a private talk, I mean, Arun is also preparing it a little bit, and he knows a lot already and learns more and more. Yeah, you are also expert already, but we are telling you the truth if it doesn't make sense. You don't have to worry that we want to sell you something if it doesn't make sense from the point of view of the precondition or of the age or of the family situation. I will always tell you, let's not do it. Let's maybe start with a Zusatzversicherung, which costs less than 100 euro, less than 50 euro to have an upgrade, for example, only for hospital or dental. And then you can decide later to go into a private one, because I have a responsibility as a consultant. I've been doing this for 30 years and I've told lots of people, wait, it's not the right time. And it's coming back to you. You are suggested new customers. they are calling you to us afterwards. They are suggesting other people to you. Yeah, we are not out there for the quick money. We make it with responsibility. You don't have to worry.
Yes, I think that I can also vouch for. We have been handling at least last 6 months, and we didn't sell everybody who doesn't need it. So it makes total sense. So I think that was a clear answer. Another question comes on chat. I think this question was answered, but like regarding the criteria, okay, I'll just skip the question, Sunit Ibala. So because we already spoke about it, I'll write you in chat and email. Now can we have an estimation, because people have been waiting to hear about the bonus as well as what will be the price for an adult? So
yes, of course.
Could you calculate for me or just in general?
Yes, we will.
Thank you.
So I will share my screen. I hope you can see it.
Yes, we can see it. Yes.
Okay, let's go into the calculation. Okay, Aaron, what are we going to do? We are going to make ladies first. Let's say, by the way, if it's the same age, ladies and gentlemen are the same prices. So let's say we spoke always about 35 years, right?
Mm-hmm.
So we maybe take this 35 years.
Mm-hmm.
Lady should be 86, right? Yes. Okay, let's just keep it that way. So as you can see here, we have a product with extra and best. As I said, comfort plus, I also said before, there's also a premium class, but that's the tariff from 1965. Mm-hmm. Yeah, and it's much more expensive than the mid-best.
Oh, Andy, can I pause you for a second? Yeah. Is Andy's audible clear for all, or is it just for me that I'm getting it with a noise? Can everybody hear him clearly, or is it coming with?
No, it's coming with a noise.
Yeah.
Still? Is it still coming with a noise?
Yeah, it's still coming with a noise.
Yeah.
Okay. I have to close the window, but it's not noisy. But let me close the window.
Okay.
And otherwise, it's technically. You guys are all. Most of you are all working in IT. I'm not.
Yeah, that's fine. It's fine. I just want everybody to hear it clearly, because it's a very interesting and important session.
This is home office live. Can you hear me better now?
A little bit.
Not really.
Okay, I try to speak loud and not too fast. Okay. Okay.
Now
you can still give me the sign. You have this mid extra and mid best. Okay. What is most suitable for you? I do the mid extra. Then we have this Krankentagegeld. Krankentagegeld is actually for compensation for your income if you are getting sick for longer than 6 weeks. Can you hear me, Aaron?
Yeah, I can hear you. Yes. Yeah.
Okay. Much better. The compensation, if you get sick for longer than 6 weeks in Germany, you have a serious disease, then your employer is only obliged to pay for you for 6 weeks. Yeah. Mm-hmm. After that, you need this thing here to cover up, to get your income from us. Yeah. And this is for an unlimited period and 100%. In TK, you have a maximum of 1.5 years and 60 to 70% only. Yeah. As I said, there is gaps in TK or in public one, what you all don't know. Hopefully you all don't know because you haven't been sick for a longer period of time. But I can tell you it happened to my sister. Yeah, she was sick for more than 9 months and she's having 3 children. And she had like 600 to 700 euro less in the pocket after week 7. And it can very easily bring you into financial bad position. Yeah.
Okay.
So if my parents wouldn't have been there to help her out, it would have been not so good. Yeah. So I would always suggest this. Then let me go on. Okay, let's see. I'm going to do the IT Berater.
Yeah.
Consultant, their job, by the way, doesn't play any role with the price.
Oh yeah,
There's only jobs what we are not insuring, but I guess most of what you guys have, we are insuring. So you see the 6 different deductibles. Without deductible, 300, 600, 900, 1200, 1500. Let me just explain this. It's for the whole year. Yeah. And this one here, the higher ones make sense if you're a freelancer. So if you would ever change to become a freelancer, then you can change here. And if you are employed again, you can change back. For the employed people, it makes sense to have a low deductible. Why? Because your employer pays half of your premium. Yeah, but the employer would not pay half of your bills. So that's why it makes sense to have a low deductible. Okay, let me see, where am I now? There. Okay. Then you have the PV, which is the same as in the public one, but it's more than 100 euro less. Yeah, that is what is on your salary slip in the public one with 159, costs only 43 euro here. And this 5 euro gives you the option to go from mid extra to mid best for the first 10 years. So you could start with a mid extra, because the mid extra is like 80 euro less than the mid best, and you can save that 80 euro for 5 euro in general. Yeah, because if you enter, you are young, you are healthy, and you only would need the mid best maybe if you are in the really getting sick, and that's what you have the 5 euro for. Then you can upgrade without a health check. Okay.
All good. Yeah.
So with the compensation of the income, let's say after 7 weeks, there's also like after 3 months or after 6 months or after 1 year. Some people have that in their working contract, but it's most of the times the bosses, yeah, or the supervisors. The common people have 42 days in general. Yeah.
All good, yeah.
So let's say we make 120 here. 120 euro means every day 120 euro. Let's say times 30 days. Yeah. It also Saturday, Sunday counts. I make it 130, then we have almost 4,000 euro of compensating of the net income, not of the gross income, but the net income. Okay. So, and that would cost 47 euro, this Krankentageld, and the whole price of all together would be, in this case, 610 euro. And you have this Krankentageld, what you don't have in TK, 100%, as I said, unlimited. You have the upgrade possibility in the best one. You have no deductible, and you have 610 euro. And in TK, you pay 923. So you could insure also already here almost 2 kids. Yeah? The kid in this tariff rate would be 178. If it's 178, yeah, you are still fine with 1 kid. Yeah. So if it's a family, for example, where both mother and father are earning above, I've had these cases a lot of times already with you, Arun.
Yeah.
Both are working, both are above 65K. Even if there's 2 children, you can put 1 children on the father, 1 children on the mother, and then you always get half of the money from your employer. Yeah.
That's true. Yeah.
So it really makes sense for a lot of people.
Okay.
And if you are single, you save 300 euro. Unfortunately, you have to give half of this money you are saving for your employer. Yeah. And a little bit you have to give to the tax, because the health insurance you deduct it from the tax. And if you pay 900, of course you can deduct more than if you pay 600. Yeah. But you will still have like 100 to 120 euro more net in the pocket here.
Okay.
Plus the bonus. We shouldn't forget the bonus. We have 7 minutes.
Okay. Yeah, please.
Okay, so that is good for an example, I guess.
Yeah. So Andy, I'll just pause you for 1 second, just for the audio thing. I'll just repeat the Krankentageld once. Just correct me if I'm wrong. So basically, if somebody falls sick, this ensures that the people get fully paid, irrespective of how long they fall sick, from the 7th week of sickness, right? So like after 6 weeks.
Yes.
So this is the purpose of Krankentageld, guys. So I just want to repeat the point. And also ME0 means the 0 is no self-deductible, which means you are deciding that you will not pay anything from your pocket and everything will be covered by the insurance. That is what deductible also means for those who have not seen this before with legal insurance or something like this. Yes, Andy, please continue. Thank you.
Okay, I'm going to do one more thing here.
Yeah.
So it's easier to explain. Just a second.
Mm-hmm.
I'm going to go to start here 1st of July.
Okay.
Because I have to show you something with a payback. Yeah. And this is a payback for half the year. Then we just have to multiply it by 2. It's not so complicated.
Mm-hmm.
Okay. Yeah. I'm creating a PDF now, okay? Yep. And in this PDF, it's stated also the payback. If you are not turning in any bills except of checkups, of course, we want you to do checkups, then you would get a payback of 600 euro, yeah, plus 584 for, this is only for July until December. So for 2021 for the rest. In 2022, this would be times 2. Yeah. So 584 times 2 is something like 1,164. Yeah. I guess, or 68. Yeah. 1,168. Yeah. Plus 600. So you will get a payback of almost 1,800 euro.
Okay.
Yeah, if you divide it by 12, that is worth another 150 euro. So you don't only have the advantage of 120, but of 120 plus 150.
Okay, and this is for one person, like it's not for the family, it is just for one person we are talking here.
Yes.
And if it's going to be kids and also both the spouses, it is applicable for both of them, like the contract.
Yeah, right. And as you can see here, if you go low, half of this is paid by the employer. Yeah. So 610 here is the monthly premium, and you yourself only have to pay 307. Why is it not half of it? Because this 5 euro is not shared with the employer. All the rest, the employer has to pay the half. Okay. Yeah. But here the 5 euro, the option for the upgrade, yeah, the employer doesn't have to pay. So this is actually your share, the 307. And then, as I said, minus, let's say 150. If you get the full bonus, then you only have 157. And right now you are paying 461 if you divide the 923 from TK, you divide it by 2. So, yeah. That is really attractive, of course.
That's really attractive, yeah. Of course, and one additional point, Andy. So this is for somebody with 35, and I think most of us are between, some of us are between 25 also here in some of our members. So possibly 25 to 35, they'll also be paying a little bit lesser compared to this 35, right?
In that, as I said, it will be something like 10 euro for each year cheaper. Yeah, 10 to 12. So it will be 100, 120 euro cheaper even.
Okay, thank you. I think that's nice. So I think this is a very, anybody have any questions on this calculation, please feel free to write or unmute and ask, because we just have 2 to 3 minutes from Andy's time. So do you guys have any question on this? Okay, then it's fine. Thank you, Andy, for this calculation. And regarding your the question is this for a single? Yes, this is for a single person, which was calculated. And for a pair, it will be individually made for husband and wife. So, yeah. And regarding the disadvantage, what Andy spoke earlier, when you want to move to a private, it's not suited for people when you have, say, 4 to 5 children, for example. So for them, it will not be highly beneficial. So that was his point. Do you want to add something to this, Andy, for whom it will not be advantageous?
Well, Of course, if you talk about a lot of children, it's always from its financial point of view. We pointed out how much money you can save now.
Okay.
But please consider the much better coverage. You have a free choice of hospital. Let me repeat that again. A free choice of a specialist, a doctor. Let's say you have a really seldomly severe cancer. There's a specialist only in the United States. You can go to the United States, which is a very expensive health system, and we will pay the doctor there. Yeah, the public one, you don't have the chance. Again, next hospital, doctor on duty. Yeah, you can also go to the United States in that case, but you have to pay it by yourself. And that will cost a couple of $100,000.
Okay.
Yeah, so don't forget the coverage. The coverage, sometimes you look at the digits, but the coverage, of course, is very important too. Yeah, that is the last point. My daughter, when she was born, my wife and me were both privately insured, and the kids who are born then automatically get the private one without a health check. Yeah, if you yourself are insured for more than 3 months, so a pregnancy longs for 9 months, so it should work out, I guess. Yeah. So my daughter had to be on with a C-section, and she was transferred to ICU right away because she didn't want to breathe. And I can tell you, as a father and as a parent, she survived it, yes, but the first 3 weeks were very tough for us. And she was a private patient, and she got medicine and stuff also in the first year, which the public one would not have paid. Yeah, it was a new medicine which was approved, which cost more than 20,000 euro, and which probably saved her life.
Okay.
So don't forget the coverage point of view. Yeah. So even if you are family and you pay 1,000 euro or 1,100 euro, it's worth to invest the 100 or 200 euro for the best coverage of your family.
That's true. I mean, I think the financial advantage is something extra, but the main focus on the private health insurance was to give better coverage and quicker service. I totally understand. I just want to finish with one question, Andy, if you have still the time, I hope. This last question. Regarding, say, for example, people take Ayurvedic treatment or other alternate treatments, is this covered or not, and how is it? Could you please tell us?
It depends on the product line again. In the best product, everything is covered. Yeah. In the Med Extra also, yeah, but they're in the, if it's not in a hospital but in the normal praxis, Arztpraxis, yeah, I think this inpatient, outpatient, I always mix it up. I think it's in the brochure. I think it's outpatient, whatever. Not in the hospital, the normal doctor's office, let's say.
Okay.
There you have limits with this alternative stuff of 2,000 or 1,000, but that is usually enough. Yeah. I mean, you need a lot of treatment already to reach 2,000 there.
Oh, yeah.
The expensive one is a hospital. The expensive one is the dentist. Yeah. If you need new teeth implant stuff. Yeah.
That's true. Yeah. So I think that's pretty much my question, Andy. I also don't want to waste your time more. So for everybody, thank you. For everybody here, I will send an email regarding all the points we discussed, like whatever that came new. I already have collected from the previous sessions. So say, for example, if there is something extra, like we didn't talk about ortho or eyes, for example. So these all are covered in the email from previous meetings. And when you want an individual session with Andy, please feel free to write if you already have my WhatsApp number or reply to the email. Both ways, it's totally fine. So
one last statement, if I'm allowed to. Even if you're not too sure yet, if you think you're eligible for it, you also can start with a Zusatzversicherung, as I said, with an additional one, with the option to change into private later, if you're not too sure yet. So it's still worth a try, of course. But it makes sense, of course, to do it also, if you are sure about it.
The Zusatzversicherung provides like faster appointments and better. They can experience the same thing with staying in the public, but with the Zusatz, right?
Yes, of course. Then you have to pay the 923 plus, plus 50 or plus 100. Yeah. But you also have the better coverage. So of course it moves you from the premium even more far away from the 600 here. It pushes you up to 1,000. Okay. But at least you are securing your health check that you're getting into it. Yeah. And it makes more sense, of course, to take the private one completely. Yeah, and don't be scared that you're not getting out. You have one joker, what all the Germans don't have. if you want to get out, just go back to India and come back after 3 months, and then you are out of the private one. If you leave the country, we let you out right away. Yeah. And if you come back, you can go back to the public. But as I said, there's no reason for it. Once you're privately, you don't want to go back to public.
That's really nice. So I think it was again a very informative session. We had a couple of new questions also from the participants. So I hope you guys spent a very valuable evening in knowing this information, whether your situation is to move to private or not. So again, thanks for your time, Andy, and thank you, everybody. I'll stay in the chat. If you want, you can write some text or question which you couldn't ask right now, but you want to ask me personally. I would definitely address that to Andy and he'll write back. And like I said, I'll send you guys the email, possibly today before 9 o'clock after having my dinner. So that's it from my side. And have a nice evening, Andy, and have a nice evening, everybody. And
Bye-bye.
bye-bye.